Which one's worse, methotrexate or prednisone? People often ask me this because they think methotrexate is worse and prednisone is safer. But is that true? Hi, I'm Dr. Megan, your prednisone pharmacist, and I'm here to talk to you about the risks and benefits of methotrexate and prednisone because people often ask me this thinking, well, I'm taking prednisone for a rheumatic disease like rheumatoid arthritis, and my doctor wants to start methotrexate to be steroid sparing. Is that a good idea or is that worse? And I think it may be because people perceive methotrexate to be worse because it's originally methotrexate was created to help out with cancer. It's a cancer chemotherapy drug, and it's often used for chemotherapy because it stops cells from growing, which is great for cancer. So does that mean it's more harmful than prednisone? Well, let me give you a little analogy. Methotrexate is to prednisone what flies are to honeybees. You don't want either flies or honeybees at a barbecue. Just like you really don't want to have to take either drug when you have a disease like rheumatoid arthritis. But you have to. And so one of them needs to be taken. And would you rather have a fly at your barbecue or bees, right? Fly, they're both super annoying. They both fly around. They both are attracted to the food. But flies aren't going to hurt you. They might be disgusting, like methotrexate will make you vomit and have nausea and other gastrointestinal side effects. It's disgusting. But honeybees can actually kill you. For some people who get a bee sting, it can be fatal. And at the very worst, pretty much bee stings hurt everyone. So either you're just going to get a bee sting, or if you're in the rare minority, you might have a fatal reaction to the bee sting. Prednisone is much more harmful than methotrexate. Here's another analogy. Methotrexate is to prednisone what cockroaches are to scorpions. You don't want either of these inside your house, right? They're both terrifying and disgusting. But cockroaches, what's the worst they can do? They can startle you, they can be gross. Potentially, they can bring disease, like if we're in the Middle Ages. But most likely, the cockroach is actually kind of harmless. It's just nasty. Whereas a scorpion, if it stings you, it's going to seriously hurt. And for some people, when a scorpion stings you, it can cause much worse complications. It can stop your breathing, make you have like seizures, and even kill some people who are like either very young or very old or lightweight. You don't want a honeybee or a scorpion. It's better to have a fly or a cockroach. They're disgusting and annoying, but they're not as bad as prednisone. Okay? And why would that be? Well, methotrexate, while it does have side effects, and some of those are awful, prednisone has 150 side effects. It has some really bad, horrible side effects that are long-term, devastating, and potentially fatal, such as infections. You have a higher risk of getting infections and dying from them, while on prednisone, you have a higher risk of osteoporosis and broken bones and fractures and dying from them. You have a higher risk of cardiovascular disease and dying from that, and a higher risk for diabetes and blood sugar changes from prednisone. That, again, can lead to fatal complications. Those are the four most worrisome side effects of prednisone, according to the European League Against Rheumatism. So we don't want to have these potentially fatal complications from prednisone, all right? Specifically, this is what the rheumatologist said about methotrexate. These are the treatment guidelines created by the American College of Rheumatology and European League Against Rheumatism. And they said that methotrexate is conditionally recommended over other medications. It is perceived in the science by the doctors to be safer than prednisone. I'm not going to tell you that methotrexate is safe. I'm not going to tell you it doesn't cause horrible side effects, because it does. But it is safer than prednisone. And then after comparing prednisone to methotrexate, this is exactly what they said. The toxicity associated with glucocorticoids, prednisone, was judged to outweigh its benefits. So the benefits of prednisone do not outweigh the risks. There are more harmful side effects of prednisone than the benefits for a lot of people who have rheumatoid arthritis. Now, this all gets tricky when we're talking about the dose of prednisone, because for some people, dose somewhere between 2.5 to 5 milligrams a day of prednisone has been shown to actually delay progression of joint damage in rheumatoid arthritis, and that the benefits of that outweigh the risks. So it's really nuanced. Everybody's different. But the damage associated with 10 milligrams or more of prednisone is perceived to be worse than the benefits that you'd get for long-term treatment with prednisone. But there's a new wrinkle in this that has come out since the treatment guidelines, and it's a new scientific article. This is what it showed. It showed that when you combine prednisone and methotrexate, that usually the purpose of that was to bring down the prednisone dose that you need to control the rheumatoid arthritis. And that would make methotrexate steroid sparing. But turn that around, the methotrexate causes side effects like nausea, and prednisone was shown to decrease the side effects of methotrexate. So that's pretty cool. This is what they specifically said. The addition of 10 milligrams of prednisone daily to methotrexate treatment in rheumatoid arthritis patients may ameliorate methotrexate side effects, specifically nausea and elevated ALT and AST. Let me translate that into English. Adding prednisone to the methotrexate was able to bring down side effects of nausea and the side effect of high liver enzymes or changes to your liver damage. That's really exciting, knowing that potentially just the combination of them is the best combination. And another fun fact is that prednisone can also be used for chemotherapy. And the reason it's often given in a chemotherapy regimen is to help out with nausea, because so many chemotherapy drugs cause such horrible nausea and vomiting that it can actually kill people. So they give prednisone along with it to bring down the nausea. So maybe that the same way it's helping other chemotherapies, it's helping bring down the nausea from the methotrexate. So the combination of the two might be the very best for some people who have rheumatoid arthritis. You'll have to definitely work with your doctor to find out if that combination is the best for you, and specifically what dose would be the best for you. In general, for both drugs, the lowest effective dose you can tolerate is the best. For methotrexate, you want to get it as high as you can while minimizing side effects, whereas prednisone, you want to get it to the lowest dose you can get the benefits of the symptoms and keep it there and to minimize the side effects like the osteoporosis long term. So that's exciting, knowing that there is new research coming out about these old toxic drugs and knowing that methotrexate is perceived by doctors and the science as a less harmful drug than prednisone. Not harmless, less harmful. Safer, not safe. All right, signing off as Dr. Megan, your prednisone pharmacist. If you'd like to learn more about prednisone side effects, you should download my prednisone checklist. You can find it by clicking the link below, and it will tell you the top 7 mistakes people on prednisone make and how you can avoid them. Click the link to download it now.